Hello everybody and welcome to the Medical Weight Control YouTube channel. I am your host Annie Rivera and we are at the Temecula location. You may have heard my guest today on our podcast if you're listening, and if you're following and listening to our Medical Weight Control podcast. This is the voice behind Natalie Lee, who is our clinician and nurse practitioner. Natalie, thank you so much for being here.
Thank you for having me.
She is our resident expert who lends all her knowledgeable opinions about certain topics that we talk about on our podcast. So why don't you tell the world a little bit about who you are? I know that for those of you who don't know Natalie, she is an avid runner, but I'll let her tell you all about that as well, and then what she does here at Medical Weight Control.
So my name's Natalie Lee, and I am a registered nurse, also a nurse practitioner, and as Annie stated, I am also a runner. What I'm doing here is I basically consult patients regarding weight loss. I've worked in family practice, I've worked in the hospital, I've also worked in women's health. My role here is basically to consult patients, new and returning, on their weight loss journey.
Temecula Medical Weight Control, this is Natalie. How can I help you?
Besides weight control, what other services do you offer here at Temecula?
So we also do Botox, which has been a big hit lately. For Botox, we can treat around the eyes, these lines right here called the crow's feet. We can treat in between the eyes, which are called the 11s, these two little lines here, and then the lines that are across your forehead as well. We just started an IV vitamin therapy, and there's 4 different therapies that people can choose from. So the IV therapy takes about an hour and a half, but we have 4 different treatments. We have a glow, immunity, we have hydration, and skinny. And so there's different formulations, but we just launched this, so we're very excited to start.
Hi, welcome to Temecula Medical Weight Control. How are you today?
So what are the benefits of each of these?
Okay, so there's 4 different therapies. The first one is Glow, and it has B complex, it has vitamin C and glutathione, and it's an anti-aging formulation. And it also helps with your immune system, and it's hydration in general. So it helps your skin and your nails and your hair. And then we have another one that's called Skinny, and it has a fat burner. It has the lipotropic ingredients in it, B12 and a B complex as well. So it helps with weight loss, and it has a fat burner. And then we also have Immunity, which I think is a great one because especially now, it seems like everybody's kind of getting sick late in the season this year. But it has vitamin C, zinc, lysine, B complex, and B12. So that's a really great one to help protect your immune system. And then lastly, we have Hydration, which will be really great for the summer or for athletes or whoever just needs to get hydrated. And it has vitamin B12, it has magnesium and sodium chloride, as well as calcium and a B complex.
So I was reading about IV therapy, and part of why IV therapy is such a big hit these days is because it bypasses the digestive system, so it's actually almost immediate.
It doesn't have to be absorbed through the stomach. Sometimes you don't absorb it for various reasons as well as you should, and so when you get it IV or IM, which is an injection, it takes effect right away.
And you can actually do this on your lunch hour.
I would say give it about an hour and a half though, because we do need to fill out forms, consents, and go over the treatments, and I do need to start your IV. So I'd say about an hour and a half at the very most.
So IV therapy takes effect almost immediately from the minute you sit down and when she starts your IV therapy, and there's not a whole lot of downtime or wait time, right?
Exactly, yes. And I personally did it because I just wanted to see, since I am a runner and I'm oftentimes a little dehydrated, unfortunately, because I run before work, or just because I lose a lot of electrolytes. I tried the hydration and I felt really good the next day. I could definitely tell the difference. I had more energy because I can tell when I'm dehydrated, I feel tired and sluggish, but I felt like I hadn't even run that morning the next day.
If you've not heard of IV therapy or you're new to it, you can make an appointment with Natalie here at the Temecula office, and she will have a consultation with you. She'll go over which of these options, which of these therapies might be best for you that fits your needs. Or if you're listening to this for the first time and you're not located in Temecula, we do have other locations, so be sure to check out our website at medicalweightcontrols.com and look for the location nearest you. Natalie, thank you so much for all this information, all this
You're
wealth
welcome.
of information. And don't forget to follow the podcast because this is the voice behind all of our expert panels and topics. Some of them are really near and dear to her heart. We just had a recent one on diabetes. You can listen back to some of the episodes where Natalie was our guest. I will have all that information to our website and to our YouTube channel and our podcast, so you can be sure to check them out. Natalie, thank you so much for being here on the show. I really appreciate it.
Thank you very much. I really appreciate it as well, Annie.